Mr. Aron, why don't you start out by giving us a quick introduction about yourself and how you got to where you are today?
Okay. First of all, thanks for inviting me. I think what you're doing here is very nice and useful. I wish I had this kind of exposure when I was opting for a medical career. So I'll start off by telling you that I'm an international medical graduate. Then I worked there for some time. Then I moved to New Zealand. I worked there as well. Then switched careers, came to US. Uh, Even in the US, I've been at least in 4 different states. I did my internal medicine residency training in Cleveland, Ohio, then did a rural service for 5 years in a very small town in Kansas called Leavenworth. Then I wanted to always be a specialist. So after completing my 5 year requirement, I went into fellowship at University of Tennessee in Memphis. And since then, I've been in Norfolk, Virginia. I've been a full-fledged specialist. I can elaborate more on any aspect that you prefer, um, or I can touch briefly on all the different phases of my career. Uh,
If you could touch briefly on each of the phases, I think that would be really cool. Yeah.
okay. So after completing my medical school, I took some time off to prepare and decide what I wanted to do. And while I was preparing for the exams, the USMLE, I took a job as an instructor in anatomy. So for 1 year, I was teaching medical students and I was working in the dissection hall. Then I went to New Zealand after that. I had to do the New Zealand exam to get approval by the Medical Council of New Zealand. Then once I cleared those exams, getting a job there was not difficult. I worked as a house officer and then as a registrar in different specialties. So I did some work in surgery and then some in medicine. And that gave me some time to decide what I wanted to do in the long run. So during that time, I started leaning towards internal medicine. But while growing up, I wanted to be a surgeon. And little background on that, most of my ancestors have been surgeons. So my grandfather was a surgeon, his father was a surgeon, and his grandfather was a surgeon. So, but in my father's and generation, him and his 6 siblings, none of them went to medicine. So everybody was excited that I got selected in medicine. But after working in different surgical specialties in New Zealand, I didn't really enjoy what I was doing. So I started doing more rotation in internal medicine. And in the meantime, I met a few doctors who had been to US, who had done some training in US, and they kind of motivated me. They said you could go there, do some training, and then always come back if you don't like it. But once I came here, it was hard to go back. I got used to the system. So I did 3 years training in internal medicine in Cleveland, Ohio. Uh, I wasn't very lucky to get fellowship straight away. I wanted to be a specialist. Even in my first year in internal medicine, I decided to go into critical care, but I wasn't lucky. So, and since I was on a visa, I had to have a job to be able to stay legally in the US. And that's when I landed up in Kansas, a very small town, Leavenworth. It's known for its penitentiary. That's what it's famous for. It's the first town in Kansas. I didn't know I would end up there, but it was a good experience. Um, I worked as an internist. I had my own clinic. I did internal medicine inpatient. After that, once I reached the 5 year mark, that was a requirement by the United States Citizenship Service that I should do 5 years of rural service to be able to stay here longer. That's when I went into fellowship. Um, Going back into fellowship after working full fledged was difficult, but that's what I always wanted to do. So I enjoyed reading, studying, research, presentations, everything that the whole 9 yards that go with fellowship training. And after training, um, this is my first job. I'm located in Norfolk, Virginia. I work in a tertiary care hospital. Um, my work is divided between ICU and pulmonary, basically. So that is in a nutshell my background.
That sounds great. You've had a very long journey and you've had like different jobs and you've definitely been around. So that sounds great. So the next question is, could you give us a description about your day-to-day experiences in the field and what a normal workday looks like for you now?
So our job requirement is divided between inpatient and outpatient. Inpatient is mostly working in the ICU setting and sometimes as inpatient specialists like a pulmonary consults. So we see patients who are the sickest in the ICU, sickest in the hospital, and also the patients who have lung problems. About 40% of the time we spend in the office seeing clinic patients. So I can give you a description of my ICU day. Usually starts at 7. We have a ICU specialist at night. They leave at 7 when we come on in the morning and vice versa. So I'm also required to do certain number of nights. So we have a medical cardiac ICU, a cardiac surgery ICU, we have general surgery ICU, and a neuro ICU. So me and my colleagues, we take turns managing different ICUs. So at one time, one ICU is manned by one person. So I would start off by looking at our list, which comprises about 10 to 15 patients, getting sign out from the night person if anything was needs to be addressed right away. Then after going through the list, I try to focus on the sickest ones. They are all sick, but certain patients take priority. So I just eyeball their medical record, look at their labs, look at their x-rays, CAT scans, and then do a preliminary round. Preliminary round means just going room to room, talking to the nurses taking care of the patients who are usually the eyes and ears for us because they are there when we may not be available. So they tend to give us like a quick snapshot who the patient is, why they are in the ICU, and if there is anything they'd like to address immediately. So after having like a bird's eye view of the entire ICU, I usually sit down and um, look at the medical records in detail. And then I do like another round when I actually examine the patients, look at their parameters. So if in the ICU, we have patients hooked up to ventilator, we have them hooked up to IV lines that invasively do a lot of monitoring. So we get a lot of information just by looking at those monitors. And then rest of the day would be variable. We can get an admission, which means emergency room may have a very sick patient who needs to come to the ICU. So I may have to leave everything in between and go address that, see them. Or a patient in the ICU may get worse. So usually when they get worse, let's say they go into shock or they stop breathing or they are having a hard time breathing. So in those cases, we are trained to do procedures like, put them on the ventilator. There's something called intubation, having a breathing tube down their throat, connecting them to the ventilator, uh, doing something like invasive monitoring. Um, so ICU setting gives you that uh, flexibility. It's not purely medicine. It also gives you opportunity to do surgical procedures. So depends on the acuity of the patient and the nature of the illness. So after that, usually we have multidisciplinary rounding, which means a cardiologist, a cardiac surgeon, depending on what the patient requires. We all meet. We also have pharmacists, we have social workers. So let's say, for example, we have a patient who's waiting for a heart transplant. So then we have a multidisciplinary meeting where we all have our own input, and we are trying to allocate and find a suitable donor for the patient, because they can't survive without another heart, let's say, for example. um, so in between, I have to find time to write notes also, because that's an essential component of our practice. We have to document what we do, and that's how we get paid, and that's like our record. And it also conveys information to my colleagues when I'm not there. So that takes a major chunk of the day, and then it's variable. So one day I might think that I'll be done today by 4 o'clock or 5 o'clock, and then suddenly, boom, uh, we get a patient who crashed on the floor, and then next 2 hours are spent managing them. So, but the good thing is our um, practice works on a shift model. So a person would work 7 to 7 day or 7 to 7 night. So we have a little bit of leeway that if you're getting tired or overwhelmed, there would be another fresh pair of eyes and hands coming over to relieve you. So that's our usual day. There are certain days we can attend known conferences with the EVMS, the Eastern Virginia Medical School. They have lectures, journal clubs. We have multidisciplinary conferences like Tumor Board. Uh, that's about twice a month, where we discuss our difficult lung cancer patients, along with the thoracic surgeon, radiation oncologist, medical oncologist. So my specialty, it gives me a number of different opportunities to take care of patients. So I don't know. I mean, I can keep elaborating, but it, it's uh, it's
I think for now that was very in-depth, and I'm really glad you went through and defined everything you were saying, and you really gave us a really good picture of what a typical workday looks like for someone like you.
yeah.
And maybe we have a lot of questions to go through, so maybe at the end we can touch on it more. But thank you so much for going in depth, and I think for especially some of our high school viewers, this
Mhm.
makes it a lot easier to visualize what it might look like if they were working in your setting.
Okay.
So, for the next question,
Mhm.
in all those experiences you mentioned and on your journey to where you got, what were some of the major challenges you had to overcome and how did you overcome them?
I think for me personally, I would divide a challenge as something like system based, that's external, and something that's internal. Um, for system based, I can tell you, for me, the most challenging was navigating my way from India to the US, um, jumping through different hoops. Um, Visa was not an easy thing for me. There's always an uncertainty that you may or you may not get a visa to practice. Clearing exams is just one part of the scenario. Then just navigating into a new system, new country, I think that was challenging in the beginning, but it was also very good. Like, it gives you an opportunity to grow as an individual. If you keep doing the same things over and over, or if you thrive on only your own comfort zone, I personally think you don't grow. So you have to sometimes challenge yourself, um, see where your boundaries are. Going to New Zealand, I had some family support. My aunt was there, my aunt, uncle, they helped me, but adjusting to a new system, a new society, for me, it was hard to understand their accent. I don't know if you ever heard Australian or Kiwi people talk. It's slightly different. How they practice medicine, learning their bedside clinical methods was different. And then coming to the US was again, once I started getting used to New Zealand, then I had to learn how medicine is practiced in US. I can tell you personally, I've done internship 3 times. Once in India, once in New Zealand, once in US. So I've been an underdog for 3 times. uh, Other challenges I would say were personal. I think all of us have to somewhere recognize our limitations and how to overcome them. I think my personal biggest limitation was I used to get overconfident easily. If I scored well in one exam, the next exam I would not study. And then I would be so disappointed. They said the examination very difficult, not acknowledging that it was a failure on my part. So I kind of started recognizing the pattern and then paying attention that this is where I make a mistake. And this is where I need to concentrate and be more serious. And I think each of us, when we go through our career, be it medicine or non-medical, we all will have some some challenges we'll have to face. Um, it depends how you overcome them. I think it requires persistence. That's all I can say. Uh, I was about to give up going into specialty when I was in Kansas. I felt like, I'm in a stable job, stable career. If I go back into training, I'll again be a student with low income uh, on a student tuition. I'll have to work with people who are probably who did their residency after me. Adjusting to that environment was challenging, but because I liked the specialty, I focused on the specialty, ignored everything else. Same as when I went to New Zealand. Um, there was a big, not just cultural difference, just the way they practice medicine. But I learned quickly. I think learning to adapt is a very useful skill that I've learned. I think I don't know if I answered your question right.
Mhm. Yeah, you did. That sounds great. Okay, so we have one last question.
Mhm.
Uh, these are the basic questions, and then we'll get on to the questions that our members submitted. So this question is, what information do you think that high school students like us should know before committing to this path?
That is a difficult question because you don't have the full knowledge. Your impression of a doctor is what you see in the media, what you see in the movies, and if you read medical fiction like Robin Cook, and that was my impression too. But then somewhere you decide what you like to do, which subject you are passionate about. What is it about medicine that would keep you going on? And that's hard to find at your age, and I had the same issue. But I think how I decided personally, I had a very good science teacher in high school who used to teach us physics, chemistry, and biology. He used to teach us all three subjects. And he did it so well with so much energy and passion that I started liking science. I also liked mathematics, but not to the extent that I debated whether I should become an engineer, let's say, or go into science like research. Then I also wanted to, be more mobile, more practical. I didn't want to sit behind a desk job, behind a computer. And then when I started this career in medical school, I started liking practical work, like working in the lab, working in the dissection hall. And that way I realized that, I could be more hands on. The way people decide, they go by, some people will say, oh, I want to take care of people. I want to, I have a very altruistic bent of mind. I want to do something for humanity. Some people will like the nature of the science, the thrill of diagnosing a medical problem or treating. It's like solving a riddle. A patient comes to you with a very vague symptom, and you try to generate more history, more data, and then you arrive at a diagnosis, and then you treat them, and they get better. Something that will drive them on. Some people are very good with hands. They want to be creative, so they are very good handyman. Let's say, for example, they will be do stuff with tools. And if they decide to go and become a surgeon, they will have hopefully a very fulfilling career, because that's like cutting, putting together in a different sense. So whatever you do, you have to have some passion, something to drive you on. For me personally, it was the interest in science. I really enjoyed science. Like, for example, physics. I used to enjoy physics a lot before medical school. It used to be very interesting to try and understand what goes on in the universe, why things are the way they are. Or in chemistry, uh, just reading about nuclear physics or nuclear chemistry. So as a student, I think you have to look at the big picture, and there are so many different options. You could be a physician, you could be a radiologist, you could be very good at reading images. You may not have to you can just be a doctor and sit in the office. There are some personalities who do not like interacting with people, so they personally, I think they become radiologists. They just read x-rays or cat scan. I may be off, I'm joking, but medicine allows you a lot of diversity. So it's not very rigid, but when you start, you have to like science, you have to have the knack or the keenness to solve problems. Um, Compassion helps people who genuinely want to take care of other people. You want to make your patients better. That is always a plus. There are some occasions when we have personalities in medical field who are arrogant, who do not treat patients well, um, but those are exceptions. So I think what you're doing is right. You talk to people, you talk to physicians, you get exposure in the clinics, in the hospitals. Um, it's not always very glamorous. Like for me personally, once a day I have to talk to a family, update them. Though most families want me to update them, but I may not have time. I may be able to sit down with one family and spend half an hour telling them how critical their relative is and they may not survive. Um, that's the hard part. So it has its ups and downs, but it's a fulfilling career. I don't agree with people who say, "Oh, it's a very long career. You know, you could have done with college and been in a job in 4 years, and look at you. You have 7 years, and then 3 years, and then another 3 years in fellowship." But I think it's what you want.
Yeah, and I'm really glad that you answered this question the way that you did, because I think a lot of high schoolers get when it's hard for them to get internships and shadowing and exposure, especially like there's the age barrier too. It can be difficult to find out of medicines what they want to do. But everything you said about even thinking about your own personality and likes and different types of professions in medicine and trying to align those was really cool and interesting. So for now, we're going to move on to some of our student procured questions.
Okay.
And for our first one, it is with respect to the COVID-19 virus, the lungs are the primary organs to get affected. What has your experience been in the past few months with COVID patients?
It's been difficult. I'll be honest with you. Since the COVID started, we were the first ones being on the front line to see the sickest patients, and not just the sickest, very young people dying, not being able to have their family members at the bedside. Initially, it was challenging for us to wear all the garb, the masks, getting used to the mask. I'm still not used to wearing a mask all the time, keeping it on for hours. That was challenging personally, but I keep that aside, seeing how people have suffered, how family members have begged to be able to do FaceTime with a dying relative because the hospital has a policy, it will only allow one family member to come in and maybe not go inside the room. The few occasions when our critically ill patient did get better, those were very, very fulfilling, very satisfying to look back. I remember two patients who were in the ICU. They were so sick that even we could not oxygenate them with a ventilator. And we have a machine called ECMO where we drain the blood, run it through the machine, it gets oxygenated, we put it back in simple layman terms. And this patient was on it for almost a month. He actually did get better. He got off the machine, subsequently got off the ventilator. And when I happened to see him 2 months later, I could not recognize him. I could not recognize him. It was the same person who had lost weight, but he was smiling and talking. So um, I think that was very gratifying. We have lost many patients, but I think you take your successes, you look at the positives, because once they're in the ICU, the mortality is much higher than what it is in the general population. In general population, they may say, well, COVID is okay, it's 3-5% mortality, but once you're in the ICU, it's greater than 50 to start with. So that was it has been a roller coaster, and I'm very happy that things are getting better. Our We right now only have two patients on the ventilator with COVID. Unluckily, they are both in their 20s, which which is not good. Meaning, earlier assumption was only the older people get COVID, but these are young people. So I still tell people, even if you have been vaccinated, do not let go, do not lower your guard.
Okay, so you kind of touched on this in your line of work. A lot of things can go wrong. So the question is, how do you cope with these things, especially during this time? So does it like take a toll on you? And if it does, like how do you cope with it? And what habits do you have to kind of separate this work and from your life?
I think the COVID has taken a big toll on everybody. We have lost majority of our ICU nurses. It's a totally different set of nurses than we had last year. I have been affected, but I try to look at the brighter side that I'm at least on the front line trying to make a difference. Um, I can't imagine being an administrator who has to make bigger decisions like allocation of resources. At one time we were even debating if we are short of ventilators and there are more people than we can cater to, how are we going to prioritize? So, and once I leave the hospital, I try to shut it off from my mind. I come home, first thing I do, I don't even touch my little children. I right away take a shower because no matter how careful you are in the hospital setting, um, there is always a risk of uh, spreading the virus. Then I try to, you know, forget what I did or put it on the back burner. Spend more time with family. Be grateful they're all healthy. Communicate with my friends and family who are in different countries. Once in a while, talk to them. Talking helps. It also is a well check that they're all healthy. Two of my closest friends from back home in India, they lost their parents in this COVID pandemic. So I think it's always been good to connect with family, friends. All said and done, it's a short life. Every phase of your life, be it school, college, it's short. It may look like long. It may look like you're going to be there forever, but you're not. We've seen young people die. You can't take life for granted. Other than that, I have some hobbies like sports and outdoors. So you need to have good balance.
Yeah, I'm glad you mentioned balance because that's a key word we've heard from multiple people. And having that support system, having things to keep you busy. So I'm really glad you talked about that. And we've been talking a lot about how COVID has been affecting us now. But how do you think it will affect our generation's experience in the field?
It's hard to answer, but I think the world has evolved in a positive and a negative way in during the COVID. Like for example, we are having this meeting on WebEx, and most of our hospital meetings are now on WebEx as well, which most people like it because it gives them flexibility to do work from home. Saying that, it also uh, has made most people realize the priorities in life, how important your family is, how important your friends are. I may be repeating myself by saying, you you a certain individual may or may not be there. You take them for granted. So, if you look at the COVID pandemic in perspective, I think there are a lot of lessons to learn. There has been a negative impact that I'm aware of or I've heard of. People staying home, getting depressed, feeling they can't get on with life. But I feel that's a very minor setback. You would rather be home and bored than be sick and hooked onto a machine in a hospital and still be alone. So hopefully this will be like any other calamity. How they say, this too shall pass. So we just have to be patient and take care of ourselves. How it's going to impact others, I think it varies depending on which age group we are talking about. I can't personally say for younger people, but I've heard they've had to do their schooling from home, which is not the ideal setting. They would rather be, mobile, more be able to play sports, mingle with their peers. But I think all of it should be history if we come out of it um, healthy. I don't know if that answers your question.
Yes, it's perfect. And so this is our last question. So what is the most challenging yet rewarding aspect of working in your field?
Saving a life,
Yeah.
saving a life. Um, you can't take credit. I think that's unjustified. But if you are one of a team who saves a life, has a patient come in an ambulance unconscious and see them getting better, walking out, and sending a thank you card, or even see them in clinic, I think that's the most gratifying. That feeling, uh, not even Mastercard can buy.
All right, so Dr. Aaron, that is the last of our questions. Again, I just want to thank you for giving us such a deep and insightful discussion. This has definitely been very different from some of our other meets because you were able to tell us so much about the impact that COVID has as someone working in the ICU. And I think some of your advice and some of the thoughts you've given are incredibly powerful, and I'm so glad you were able to be here.
No, thank
But
you.
before we end, do you have any parting thoughts, last words for our audience viewing this?
Um, I would say at your stage or people who are in college, the only advice I can give is meditate. If only you can take 5 minutes of your morning and meditate, it's going to be very, very good for you. I didn't reap the benefits till very late, even though I read about it. I think in current time of multitasking, everybody having no time but still having time for their iPhones. I think it's important to have a perspective, and if you can just incorporate this habit, I think it will go a long way in your academic career. I just recommend 5 minutes. Wake up in the morning. The first thing you do, sit quietly, meditate for 5 minutes. I hope this doesn't sound silly, but
No, I think it sounds great. Meditation does have many good benefits, so I completely agree. But thank you so much for coming. Your view and like your experiences and all the things you've told us, our members are absolutely gonna love hearing it. And like Melon said, it is different because you were frontline worker, you are a frontline worker, and you've been dealing with the pandemic a lot with the ICU and the pulmonary. So it was really interesting to hear your side. So thank you so much.
Welcome. Thank you for inviting me, Vanchika, and thank you, Helen.